Now from the 12 News I-Team, a Valley naturopath has been disciplined after allowing an unlicensed medical assistant to treat a patient experiencing complications.
And the problem stemmed from a full-body liposuction procedure. And as Team 12's Bianca Bono explains, some medical professionals do not believe naturopaths are qualified to perform these types of procedures in the first place. Bianca?
Plastic surgeons argue naturopaths don't have the education or qualifications to perform surgery. Under Arizona law, naturopathic medicine involves non-surgical methods, though the license does allow for minor surgery. The question is liposuction really minor? Tonight, we take a look at a board decision involving a naturopath who performed liposuction, though as you'll see, the board doesn't address the surgery, only what came after it.
I have concerns.
A recorded meeting for the Arizona Naturopathic Physicians Medical Board includes one member's concerns about Dr. Jose Ortiz, a licensed naturopathic physician and the subject of this complaint from a female patient who said Ortiz recently performed 360 liposuction on her.
All of the areas from below the breast line, she was not happy with the fact that her buttocks wasn't as large as she wanted it to be.
During the disciplinary hearing, the board showed less interest in the physical results and more in the treatment of the patient after the surgery was done. That's when Ortiz said the patient was experiencing complications and asked Ortiz if she should go to the hospital.
She was having some issues with drainage. I texted her that she should go to the emergency room if she felt like she needed to.
The board critical of Ortiz's response.
You said protocol is to send the people to the emergency room. And then you broke protocol by only saying only if you need to, but I don't know how the patient's supposed to know if she needs to or not.
Instead, Ortiz said he was out sick and had her see a medical technician who worked in his office. When the board asked if that tech was licensed, Ortiz said she displayed a certificate in her office and never confirmed whether she was appropriately licensed to perform a fluid drainage procedure. He said he had no affiliation with her and described her as a tenant in his building.
I don't know what she was working at.
He allowed her to do the procedure unsupervised anyway.
You don't know anything about them, is what you're saying. You don't even know what they're doing, and you said, no, go have her stick a needle in you. What I'm trying to understand is how you came to the conclusion that it's okay to send her to this particular person.
This investigation coming amidst criticism from the medical community that naturopaths like Ortiz are practicing outside their scope of practice when performing cosmetic surgeries. There are no clear statutes defining the scope of practice for naturopaths in Arizona, and the American Society of Plastic Surgery says the Naturopathic Medical Board has failed to address the problem, asking the Arizona legislature to step in.
We brought it to the attention of the Naturopathic Board and said, hey, there's a problem, can you help us deal with this? We didn't really feel like that got the attention that it deserved, and certainly the patient safety issue has not been addressed.
In this most recent case, the board opting to discipline Ortiz, not for the liposuction, again skirting the issue of scope of practice, only disciplining him for referring his patient to the unlicensed tech.
It's just not okay.
Placing him on probation for 6 months. Through his attorney, Jose Ortiz declined to comment for this story. Now, following our previous reporting on the LIPO loophole, the Arizona Naturopathic Medical Association created a committee to explore this issue of naturopaths performing cosmetic surgeries. Bianca Bono, 12 News.